I think it's helpful for you guys to see real world application. And I know a bunch of you had questions about how the AI scribe works. Let me show you an example. Now, I'm at home. The whole idea of using an AI scribe is not to do documentation at home. So this is going to be a made up case. This is not a real patient. This is not real information, but I'm using this as an example. Let me share my screen. If I was in the clinic, I would have the AI scribe up and running. You can see it behind me on the screen. Now I'm going to choose a Medicare treatment note. This is a template that I've created. I'm happy to share any of my templates with any of the users. And then what I'm going to do is I'm going to hit start recording. My name's Tony Maritato. I am the licensed physical therapist delivering today's treatment. Today's treatment session started at 5:30 p.m. and finished at 6:30 p.m. Today is May 2nd, 2024. My patient started with therapeutic exercise CPT code 97110. We performed 10 minutes of continuous ambulation on the ARC trainer at level 35. My patient exhibited no adverse response. His heart rate remained normal and respiratory rate remained normal. From there, we performed 3 sets of 30-second calf stretch on both the right and the left side. We performed 3 sets of 30-second hamstring stretch on both the right and the left side. And we performed 5 minutes of self soft tissue mobilization using a rolling pin to massage bilateral upper thigh and calf muscles. After we finished the therapeutic exercise portion, we progressed to the therapeutic activity portion, CPT code 97530. Today's treatment goal was to improve my patient's ability to independently sit and stand from a standard 19-inch chair without using upper extremity assistance. My patient was able to perform this after today's treatment, thereby meeting his treatment goal. We started the therapeutic activity intervention by educating the patient on body mechanics, positioning, and hip hinge. We performed 3 sets of 5 repetitions, sit to stand from a 24-inch surface, and then we lowered the surface to a 19-inch surface for an additional 2 sets of 5 repetitions. My patient initially required upper extremity support to push himself up from the chair or to control his descent, but by the end of the education and therapeutic activity, he was able to perform this independently without using upper extremity support. After that, we progressed to CPT code 97116 gait training. We worked on ambulating without an assistive device. We walked 5 laps of 25 feet without assistance. We walked 5 laps of 10 feet, carrying a 10-pound basket at waist level. We walked emphasizing heel, midfoot, toe off gait pattern, and we tried to increase the distance of the stride length bilaterally. Okay, so I just paused it because now my dog was going to start barking and I got a ring notification. I'm going to go ahead and mute my ring real quick. And then I'm going to finish the note. The final element of today's treatment included manual therapy, CPT code 97140. Manual therapy included soft tissue mobilization to the lumbar spine and right posterior hip. My patient was reporting hip pain and specifically pain in the gluteus medius on the right side. Palpation revealed point sensitivity and pain at the right trochanteric bursa as well as the right gluteus medius. After 15 minutes of manual therapy, my patient reported reduced subjective pain and improved mobility in the hip and lumbar spine. The billing information for today's treatment, we provided 4 CPT codes. Each CPT code was 15 minutes in duration. The CPT codes included CPT code 97110, 97530, 97116, and 97140. There was no communication with other providers following today's treatment. My patient is scheduled to return for physical therapy on May 6th, at which time we will work on independent sit-to-stand transfers from a 12-inch surface. Okay, I paused it. Again, these are made up notes. I'm trying to think if would there be other elements that I missed? When you think of the Medicare required elements, we need the date of service, we need the total number of minutes, we need the each timed code number of minutes, we need, I don't know if I already said it, the therapist's name who delivered the service, and we need the specific interventions that were delivered. I hit all of those Medicare requirements. So now what I'm going to do is I'm going to end the session. It says, do not close the app or navigate away. Now it says upload was successful. You can start another recording. I don't need to do another recording. You guys heard the audio from that. What I'm going to do is I'm going to pause this recording and then I'm going to let you see what the AI generated. And remember, this is based on my template. You can create any template that you want. I've got multiple templates. I've done this. It spelled my name wrong. I've done this across like condition specific templates, payer specific templates. I've got templates for United Healthcare. I've got templates for Medicare. There's lots of different ways that you can do this. I'm going to pause and I'll bring you guys back in just a moment. What I did real quick was I went into the Medicare template and under therapist's name and credentials, I went ahead and typed my name in there just so the spelling is correct for future reference. But let's take a look. Now, I've got a couple different ways to do this. So like this section says treatment goal, but obviously there's a lot of stuff that kind of went into this section. There's information about each of the CPT codes. So in other words, therapeutic exercise, 10 minutes of ambulation on the arc trainer, bilateral calf and hamstring stretch, 5 minutes of self-soft tissue goal, facilitate muscle flexibility and endurance. So it actually created kind of, I would call them impairment goals or goals for each of the therapeutic procedures. That's fine. I don't need that, but that's what it ended up doing there. Here's really the main body of the SOAP note. So it says here, patient did not report any specific improvement or decline in function since the start of care during today's session. There were no self-assessments mentioned by the patient regarding changes in pain levels, range of motion, balance, stability. So like that's something that I forgot to give the system. Usually when the patient walks in my clinic, we say, how are you doing? What's different? What's getting better? What's getting worse? I didn't give the system any of that information. There was no mention of a change in the ability to perform functional activities like standing, walking, sitting, blah, blah, blah. Okay. Objective. During today's session, May 2nd, patient engaged in several therapeutic exercises. Initially, the patient performed 10 minutes of continuous ambulation on the arc trainer set to level 35, maintaining normal heart rate and respiratory rate. This was followed by stretching exercises, including 3 sets of 30 seconds calf stretch, 3 sets of 30 seconds hamstring stretch, both sides. Additionally, a patient performed 5 minutes of self-soft tissue mobilization. If we do a little bit of quick math, we've got 10 minutes here. We've got a minute and a half. That puts us at 3 minutes. And then we've got 5 minutes. So technically, we've got 18 minutes in that time. I said 15 minutes of therapeutic exercise, but you can see here we have at least 15 minutes justified. Therapeutic activity aimed at improving the patient's ability to independently sit to stand from a chair without upper extremity assist. Initially, the patient required upper extremity support. Go ahead. But achieved independence by the end of the session. This included 3 sets of 5 repetitions, sit to stand, 24-inch surface, then down to a 19-inch surface, educating on body mechanics positioning. There's no time associated with that, but roughly speaking, that would take about 15 minutes between the educational component, the practical component, and finishing what's happening there. Gait training was conducted, focusing on walking without an assistive device. carrying 10-pound basket, emphasizing appropriate gait to increase stride length bilaterally. The patient successfully completed the activity across various conditions: 5 laps of 25 feet unassisted, 5 laps of 10 feet with weight, and attention to heel toe gait pattern. Then manual therapy for 15 minutes, soft tissue mobilization, lumbar spine, right posterior hip to address pain and mobility issues in the gluteus medius and trochanteric bursa. Significant improvement in pain and mobility after the treatment. All interventions were timed and documented appropriately, with the total of 4 CPT codes provided, each lasting 15 minutes. So interesting. I did indicate that time. Today's session evidenced significant progress in the patient's ability to independently sit to stand from a standard 19-inch chair. A primary treatment goal was fully met by the session's conclusion. Initially requiring upper extremity support for transitions, patient was able by the end to perform these actions without assistance, indicating improved strength and body mechanics. Now, it doesn't necessarily specify that it was upper extremity assist for the sit to stand, but I can always add that if I think it's an important element. Patient also responded positively to therapeutic and manual interventions with no adverse response noted. Improved stride length and heel toe gait pattern during ambulation without an assisted device was observed. Manual therapy led to a decrease in reported pain levels, enhanced mobility. The outcome reflects a favorable response to treatment plan established, promoting optimism for continued improvement in function and mobility. Plan during the next physical therapy session scheduled for May 6th. The treatment plan will focus on advancing the patient's ability to independently perform sit to stand from a 12-inch surface. This progression aims to enhance functional mobility. As of today's session, there was no communication with other providers. This treatment was provided by Tony Maritato. So like that's misspelled. I would just change it. Licensed physical therapist. Then we've got our 4 CPT codes with the minutes for each of the CPT codes. I'm going to change my name again. It took place May 2024 from 5:30 p.m. to 6:30 p.m., totaling 60 minutes. So it gives us total treatment time in minutes. Detailed description of the intervention aligns with the outlined required Med B for specific CPT codes. Tony Maritato provided a total of 60 minutes of timed direct treatments as indicated, spread equally across the 4 CPT codes. So it's just kind of reviewing. All requirements were met, scoring 100 out of 100. Great job for providing comprehensive and well-documented information aligning with Medicare Part B requirements. Keep up the excellent work in delivering detailed and valuable patient care. And then I was just playing around with a couple other things. So like this is a different format for the billing. We've got our 4 CPT codes, total treatment time in minutes, start time, finish time, right there, therapist, spelled wrong again, licensed physical therapist, delivered today's treatment.